Hello and welcome to all of our Gold viewers here today. My name is Kristen Schwartz. I'm a licensed midwife and one of the MCs here at Gold. And today I'm here with Tanya Singleton. Welcome, Tanya.
Hi, good to be here.
It's good to have you back, Tanya. And this time you're here for our new Labor and Delivery Symposium of 2024 that we will have available later in the year. And you have a fantastic presentation titled Establishing Breastfeeding and Bonding in the Post-COVID Hospital Setting. So before we go into the topic, tell us a little bit about yourself and your background. You're a registered nurse. You've been working in this field for a really long time. So give us a little update of your journey.
Well, I've always been fascinated by all things birth. So, um, right out the bat, I knew I wanted to be part of birthing, labor and delivery nurse. And so I was a labor and delivery nurse in the military and um, actually got to deliver lots of babies by default there. So, you know, performing as spontaneous midwife when things happened or they didn't happen as they were supposed to. Did a lot of high risk. So I
Mhm.
really appreciate the natural and the normal.
Yes. Yeah.
After having worked, because I am certified in high risk perinatal, all the high risk births that I attended in the military, being at major medical centers, and initially out of the military, also working at major medical centers, I saw lots and lots of deliveries that required intervention, and not the best outcomes for mother or baby. So I fine-tuned my skills in high-risk perinatal nursing. But my passion is always for mothers' ability to do it on her own, and
Mhm.
always applaud and support that. So
Mhm.
I kind of got the reputation as being what we refer to as one of those granola crunchy labor and delivery nurses.
Absolutely wonderful.
I know the bad enough to see it when it's happening, but I don't
Right.
want to interfere when
Interfere with
everything is
the
going as nature intended it.
trusting the woman's body. Right.
Right.
Absolutely. And of
And
course,
letting her
jumping in if
trust
there's something.
right.
Yes.
And letting her learn to trust herself, because that's so important in establishing a parenting relationship. It's her being
Absolutely.
able to trust her body initially to give
Hmm.
birth and sustain life
Hmm.
and parent,
Hmm.
which is kind of the basis of my private practice.
Absolutely.
Um,
And many, I mean, I think all of our viewers who are here today watching this, they came to this profession because of the love of it, right? You have all these passionate care providers out there who really want the best for mom and baby and them have the best possible birth, not just healthy mommy, healthy baby, but just from a bonding perspective, because we know how important that start in life is. And then uh, COVID came, right, Tanya? COVID came and
COVID came
changed
and put
everything.
us back 25 years.
25 years. Yes, yes. And that's hard because even, the most compassionate caretakers, we're stuck in a hard place. They were like, yes, we need to be safe. And
Mhm.
nobody really knew this thing, COVID, and how can we be safe? How can we keep the baby safe? How can we, and all these restrictions were put in place. And now, a little bit after COVID, do we really have to still talk about this, Tanya? Tell me, I know we have to, but give
So,
me a little bit
so,
because we're
so
all
my,
tired of it, and right?
I
We don't.
know. I mean, it's not going away.
It's
It's
not.
just
No.
changing. I mean, it's
Hmm.
just like the
Right.
flu.
Right.
It's always going to be with us. I mean, in my public health studies, I was very much interested in epidemiology, but my concentration was maternal child health. So I really couldn't have like a secondary, but I took all the epidemiology courses that were available to me. And, there's some things that just don't change.
Hmm.
The physiological truth that the mother is the safest person for the baby never changed. When they were separating moms from babies, they're
Yeah.
like, unless mom can't hold up her head or breathe, there's no reason to separate the mom from the baby,
Mm.
right? Her body is producing antibodies that are going to protect that baby in her breast milk. It's going to protect
Absolutely.
that baby from the virus that was so devastating.
Mm,
And there
mm,
was nothing to support nothing in evidence to support separating moms
hmm.
from the babies. Um, and, you know, that was something that I found was devastating. I mean,
Devastating.
I continued my practice during the pandemic because moms didn't, you know, people were rushed out of the hospitals. They were rushing themselves out of the hospitals. I can't blame them. I would have done the same thing. I would have been somebody drag me out of here. My baby's out of my body. Drag me out of this hospital. It's not a safe place to be. But that being said, they had no help, no support.
Mm,
So I initially started virtual support. Many mothers were literally initiating breastfeeding at day 5 because they had been separated from their
so-
babies in the hospital.
and no
Um,
support. Yeah.
they had never had the baby on the breast in the hospital because as soon as they were out of quarantine, they were both sent home. So it was devastating, but you know, we worked through, powered through. Many of them were able to revive a milk supply.
Hmm.
Um, Not so much getting the baby to breast, but at least providing breast milk for their babies, which I always tell them this is breastfeeding too.
Yes, it
You
is.
you
Absolutely.
are sustaining life, whether the baby latches or not. Not as convenient, but it's just as healthy.
Hmm.
And so I think we just need to like make sure we always make our policies reflect the science.
The science, yes, absolutely. As
The
you mentioned, there was,
science.
yeah, there wasn't the evidence. It was, and Tanya,
Everything was kind of fear-based.
if you, but where are we thinking we are now? Are we back to before, with our restrictions? Are we back to everything back or,
Well,
uh,
you know, I think in some places we went overboard with the
mhm,
number of people attending a delivery because you know, I supported significant others, but I did not support the 10 cousins. I have been in deliveries where you know, there were literally 10 to 12 people in the delivery room, and I basically said, you know what? I don't think there's enough oxygen in the room for the baby. Somebody needs to leave. Because that was all I could come up with. And some people did leave. And mainly it was because mom's mortified because Uncle Sam is in the corner and, you know,
Mm,
she's splayed open and she's not, you know, she's trying to maintain some modesty. Um, and so getting everybody out except, you know, the dad
mm,
and whoever else is the helpful person that's going to be the doula type,
mhm,
postpartum doula there to help is, you know, what I felt was helpful. And basically, when I taught childbirth classes, I did tell them, I said, if you need us to be the heavy and run people out, we can do that. If you feel that you're going to hurt somebody's feelings who thinks they're entitled to share the birth of your child with you, but the only person that's entitled is the person that put the baby in you,
mhm,
you know, or whoever is going to go home with you and that baby and is going to be waking up in the middle of the night with you with that baby. So, and I think now most facilities are limiting it to no more than 2 to 3 support persons. And I think that was coming back from COVID, but I also think that's a good thing because I think it facilitates the core importance of the triad of parent and child
mm,
that is necessary for learning the child and
mhm,
learning the cues and realizing that it's not necessarily going to be what's common practice in your childbirth class or the internet tools that you use instead of childbirth class now to tell you what to expect when you're expecting and what to expect immediately post birth. Um, for all the years that I taught childbirth classes, there was never any mention of the 9 stages
mhm.
in the parents, you know, for the parents to be aware of. And I think that's critical for them to understand.
So talk
Um,
briefly about the nine stages since you mentioned it here. I know you will discuss this in your presentation, of course, but just because you mentioned it here, somebody listening who might not know what that means.
well, I hope they will look it up and read the studies because Wisdom did a magnificent job of breaking that down from many, hundreds, thousands of observations of newborn behavior afterwards. As IBCLCs, we know about the golden hour. Well, who thought we
Hmm.
needed more than an hour?
Mm,
Right. I remember, as a labor and delivery nurse, okay, we really need to like not rush these moms in recovery here.
right.
Once we started bringing the babies or allowing the babies to stay into that recovery period. Because and recognizing when the baby's not ready, it's not that there's something wrong with the baby, it's just that the baby needs time to transition.
Time to transition, correct.
And it's a physiological process
Hmm.
that we're
Hmm.
trying to rush that's not intended to be rushed. And, home birth midwives have known this for centuries. Um, and that's something else that increased with the pandemic. People were afraid to go to the hospitals, and so they experienced
Right.
births at
Hmm.
home, which is
Hmm.
completely different experience. But it's very much baby led.
Hmm.
And so that's something again that's not necessarily taught, certainly not taught in nursing school.
Which it
Um,
should be, right, Tanya? Why
oh,
isn't it?
let me tell you
Why
all the
isn't
thing
it?
when I was teaching in nursing school, I would kind of get in trouble because I had stuff that was not necessarily in the textbooks, but it's like if you want to be a labor and delivery nurse, these are things that you need to be aware of, and these
Hmm.
are resources that you need to study that are not going to be taught in school. Um,
Hmm.
and so, allowing the baby to take the time to, the nine stages are all about baby led bonding and breastfeeding. And as long as we're there to ensure safety, we're observers and
Hmm.
teachers, not hands on. I just remember how hands on we were as labor and delivery nurses from the beginning,
Yes. Hmm.
until the turn of the century when we got a little less handsy, but we're still pretty handsy from what I've
Right.
seen. And it's
Mm.
like, it's not a bad thing when it's needed, but it shouldn't be the norm.
I absolutely, and I heard you say something earlier when we were talking, and in your presentations, I have heard you say this that we should give the baby more credit, right?
Yes.
You always say that.
Yeah. Babies are very smart. They have the instincts for survival that we have killed in ourselves,
Hmm. Absolutely,
you know?
absolutely. Yeah.
And we tend to like deaden it. I mean,
Hmm.
when we did birth to three, you know,
Hmm.
in gold, so many of those instincts that we
Yeah.
need to allow children to develop and not try to pigeonhole them
Hmm. And rush them. Yeah,
and rush them.
absolutely. Yeah.
I
So
kind of
Tanya,
mentioned a little bit in my talk about my youngest grandson
yes.
who was born like right in the middle, right after
Yeah.
COVID. They moved right after COVID, and he had had a little bit of experience in daycare, but after that, he was attached to his mother, literally.
Mhm.
She had no intentions of him nursing to three, but they were isolated, and that was his
Right.
comfort level, and he was literally attached to her. And it'll be
Yes.
interesting to see how birth to three children are years from now
Yes.
that experience that family isolation of COVID,
Absolutely.
because it's they're developing differently.
Yeah. Yeah.
They
Oh,
have they have a different sense of self is what I'm seeing.
That's interesting. It will be very interesting to see in the years to follow. Now, looking to the future, Tanya, what kind of lessons have you learned during the pandemic in the care you give, and looking forward, because we always hear, well, it's not a matter of when, if, it's a matter of when we can expect something, coming up
Yeah.
again. What
Hopefully
would you
not for another 100 years, but
hopefully not, but you know, there's always something in the media. Is it bird flu or this or that, whatever it
right,
is, right?
you know,
What have you learned, and what would you like to give on the way to our viewers before I let you go?
I think remembering the basic tenets of safe practices
Hmm.
with the evidence that supports those safe practices, and not
Mm.
operating off of fear,
Hmm.
because we know, hand washing has always been,
Yeah,
you know barriers, but there should be no barrier between mother and child.
mother and child. Correct.
Right,
Absolutely.
they were one before they invited us to help them.
Oh, I love this saying. I will I will quote you on that. I love that absolutely so much. Well, Tanya, it has been an absolute pleasure hosting you today and learning from you, from your presentation. Thank you so much for being here with us today.
Thank you for inviting me. It's a pleasure.
So, Tanya Singleton's presentation, Establishing Breastfeeding and Bonding in the Post-COVID Hospital Setting, is part of our Labor and Delivery Symposium coming up here at Gold. You can find out more about this presentation and all the other presentations in the symposium. You can go to goldlearning.com for more information. Thank you, everyone, for participating and watching here today. Have a lovely rest of your day, wherever you are in the world. Bye-bye.